Well, again, if you think about this like an organizational theorist, and I certainly don't claim to be one, you want it to be neater and cleaner all the time. Now, government, governance, and democracy are never neat and clean, so this is pretty pristine and a bit artificial. But these are the kinds of things that I think an organizational theorist would say what government should do and what the LHIN should do. So the government should be in the business of high-level policy, and the LHIN should be implementing high-level policy, but be free to make some mid-level policy, and certainly micro-level policy. Government's job is to define performance. It should say, this is what we want done, and this is what we think good performance means, and LHIN should perform. Government should govern, and LHIN should manage, in large measure. Government has the authority to decide what is to be done, but then the LHINs should be, in very large measure, free to decide how it ought to get to be done. Macro allocation of funding to LHINs is, of course, a big job of government, deciding which LHIN gets how much money and on what formula. And the LHIN should be very free to do the micro allocation to programs and services. They should be free to move money around in order to get what government wants done. And finally, government should devolve some accountability at least, and also provide the LHINs with the resources and, where necessary, develop the capacity to receive it. And the LHIN should happily receive accountability and answer for their deeds, and stand up in public and make some courageous decisions, be free to make some mistakes, and answer for them. So that's the pristine ideal world, and I think if something like this turns out to be what happens, then the LHINs have a pretty good shot at being not only quite successful, but even more successful in some ways than the regional health authorities.